Have you experienced sexual assault or intentional relationship violence of any sort within the last 7 days? We know you may not feel safe. You may not know who to talk to. You may feel alone and vulnerable. Forensic nurse examiners are here to help you navigate this difficult time. You'll be heard and you will be cared for.
We have trained forensic nurses that are able to receive these patients and provide that exceptional care with a trauma-informed lens.
We can help you make informed decisions about your health and situation in a safe, non-judgmental, and comforting, confidential space.
When you go to the hospital, you need to advocate for yourself and make sure you're speaking to a forensic nurse examiner because they have the special training. They feel passionately about what they're doing. And there's also privacy there, and there's time. The word forensics means for court. So what the forensic nurses are trained to do is to gather evidence from a crime scene, which is the human body, in a way that we can present it in court, because we can show that the evidence is reliable, it's been gathered reliably, it's been stored properly, and then the people who will speak to it, which are the forensic nurse examiners, are court experts.
We in no way will sway our patients to make a decision based on what we feel they should do. A lot of times patients have a really hard time making a decision, especially in drug-facilitated sexual assault incidences where they have no memory of what happened. And many patients might look at you and say, I don't know what to report, I don't know what to say, I don't know what happened to me, so why would I report that?
When you report, you're starting the conversation. So we can't start healing unless we talk about what happens. And if we live in a place of shame, that shame builds, and our fear around exposure actually prevents us from seeking help. So sometimes talking to a trusted professional is the first step in rebuilding your life.
When patients come in and see a forensic nurse examiner, they are presented with 3 options for care. One is medical care only, without any sample collection and no remittance or phone call to the RCMP. Their second option would be a medical examination again, with their forensic samples collected and stored for up to a year. Again, no phone call to the RCMP or police. And then the third option is the medical examination with the medications, the forensic sample collection, and remittance to the RCMP or police.
The beauty of having the 3 choices is you get a chance to think about it, because when you've suffered a trauma, it's not actually the best time to make a decision. So people struggle with that with police because we show up and we just want to know what happened. And we know that it takes about 48 hours for memories to actually solidify. So part of my role, as well as I take a lot of secondary statements so people can talk about what happened and they remember a lot more. So forensic nurse examiners gives you time to breathe and to figure out what your next steps are.
Knowing that the FNEs are there, that they are specifically trained, and that this is the job that they do and that they want to do is extremely comforting for the survivor.
We know that our collaborative response directly impacts the recovery of a survivor and how they are able to walk forward after the crisis part of this experience and where they go next and what they do next. It's really important that they see us as a team.
The way that these services can help a survivor when they are ready to reach out is that they give the message to the survivor that they are not alone, that the community is here for them to help them find ways through their healing journey. They reaffirm to survivors that their experience matters and that we need to both help them to recover from the trauma that they have suffered and also try to prevent those traumas from occurring in the future, if at all possible, on more of a social scale.